Nigeria carries a deadliest weight of malaria, accounting for a staggering 31% of global deaths, with the country's public health experts, frontline workers, and everyday citizens leading the charge. The slogan is more than a call, it's a challenge. The World Health Organization, alongside partners and local stakeholders, is urging for renewed investment, bold innovation, and grassroots momentum to end malaria. Lilian Ogazi reports.
Every year, on April 25th, the world unites to commemorate World Malaria Day, a global action to end one of humanity's deadliest disease. In 2025, the theme Malaria Ends With Us, Reinvest, Reimagine, Reignite could not hit closer to home than Nigeria, which bears the highest burden of malaria globally. Africa accounts for about 94% of malaria cases and 95% of malaria deaths, according to the World Health Organization. And Nigeria, Africa's most populous nation, stands at the epicenter, responsible for approximately 31% of global malaria death. So, what does the fight look like on the ground? And what hope does this year's theme hold? What is the financial burden on Nigerians?
Much kudos to the National Malaria Elimination Program. I've been in this space for quite a long time to say their efforts has really been paying, and give thanks to so many funders, Global Fund, USAID, and few others that have really been very supportive to see how malaria tends to end in the country, and then we reduce the burden. And we see good works with the SMC programs, the seasonal malaria chemical prevention, which has actually been more focused to see how children under 5 are actually protected, from malaria.
As of 2020, the WHO has estimated over $2 billion have been estimated to have been spent on malaria diagnosis, management, treatment, and preventive measures. Luckily, there are programs in place right now for prevention in terms of vaccine and vaccinology.
Despite the grim statistics, a glimmer of hope emerged in October 2024 when Nigeria receives its first shipment of 1 million doses of the RTSS malaria vaccine. This historic step, made possible with support from Gavi, UNICEF, and the World Health Organization, could mark a turning point.
We were able to introduce, starting with 2 states. We had to prioritize 2 states because there's a constraint. There was a constraint in the supply of the vaccine, but we also wanted to learn. It's a new kind of vaccine. Each person has to get 4 shots over a certain period, and that's a new experience for us. So we needed to learn. We are learning from that experience. 101,158 children have been vaccinated across the 4 states. We got 1 million doses, and give or take a little bit that we used for testing and reserves. That will serve about 250,000 children across both states.
The theme of World Malaria Day 2025, Malaria Ends With Us, calls for reinvestment in proven solutions like insecticide-treated nets and diagnostics, reimagination of outreach strategies, and reignition of community-level activism. The path won't be easy, but with over 200 million lives on the line, the time to reinvest, reimagine, and reignite is now. Lilian Ogazi, Trust TV News, Abuja.